The World Health Organization or WHO is investigating whether there is any connection between manufacturers whose contaminated cough syrup it has linked to the deaths of more than 300 children in 3 countries. Citing unacceptable levels of toxins in the products, the WHO is seeking more information about the specific raw materials used by the 6 manufacturers in India and Indonesia to produce medicines linked to the recent deaths, as well as whether the companies obtained them from some of the same suppliers. The WHO is also considering whether to advise families globally to reassess the use of cough syrups for children in general, while questions over the safety of some of these products are unresolved, a person familiar with the case told news agency Reuters. The death of children with acute kidney injuries began in July of 2022 in Namibia, followed by cases in Indonesia and Uzbekistan. WHO has said that the deaths are linked to over-the-counter cough syrups the children took for common illness and which contained a known toxic, either diethylene glycol or ethylene glycol. To date, WHO has identified 6 drug makers in India and Indonesia who produce the syrup. These manufacturers have either declined to comment on the investigation or denied using contaminated materials that contributed to any deaths. The United Nations Health Agency said on Monday that it had widened its investigation into potential diethylene glycol or ethynyl glycol contamination in cough syrups to 4 additional countries where the same product has been on sale. These countries are Cambodia, the Philippines, East Timor, and Senegal.